Go get on the track.
Welcome to Convinced and Confident. My name is Sera Gilmore, and my co-host is Tamara Bluedorn. And each week we bring to you an inspiring message or person that will help you on your journey to self-discovery.
Hello, everyone. It is another great day here at Convinced and Confident. We have a great topic today, and it's about the effects of COVID-19 on the communities of color. And our special guest is Dr. Roxie Wells. Dr. Wells serves as president of Cape Fear Valley Hoke Healthcare, comprised of Hoke Hospital and outpatient clinics and services. While serving as president of Hoke Healthcare, she served as president of Cape Fear Valley Bladen County Hospital until June of 2019. In her current role, she provides executive leadership and operational management. In 2015, Dr. Wells led Hoke Hospital's team in acquiring state licensure and CMS and Joint Commission accreditation. In addition, she led both teams in acquiring Joint Commission disease-specific certifications in pneumonia and sepsis at Bladen Hospital and chest pain and stroke readiness at Hoke Hospital. Dr. Wells has also served as Associate Chief Medical Officer for Ambulatory Services, which included oversight of the Cape Fear Valley Medical Group and associated ambulatory clinics. She has a passion for rural healthcare and believes that healthcare in rural communities must be collaborative effort and therefore has worked very closely with organizations in both counties. This was particularly true in Bladen County. She formed a partnership with Bladen Community College to provide nursing scholarships for students and a grant for a nursing instructor, which has allowed for the expansion of the nursing program at the college. She has also formed partnerships with the Bladen County Health Department and Bladen County EMS. Dr. Wells is a board-certified family physician and is a member of the American and North Carolina Academies of Family Physician, the National Rural Health Association, the American Hospital Association, and the North Carolina Healthcare Association. Dr. Wells enjoys reading, traveling, developing community health initiatives, and public speaking. Thank you so much for joining us today.
Good morning to everyone out there. We have as our guest today, Dr. Roxie Wells. Dr. Wells, we have been, I want to say, locked down actually from the beginning of 2020 for so many months due to the COVID virus, the COVID-19 virus, or some call it the coronavirus. So I wanted to talk to you a little bit today and let you share with our audience the effects of this virus on communities of color. So I want to begin by thanking you for being with us. And I'm going to start with simply saying, what actually is the coronavirus and its symptoms?
Thank you, Ms. Gilmore, for having me on the program. You and Tamara, I think you guys are doing an awesome service to our community and just the country or cities and towns and states across the country, doing a great service in sharing your information and your unique experiences with us as women and people in general. To answer your question, the novel coronavirus is a virus that we think came out of China and has spread across the globe. We don't know the exact origin of the virus, and there are a lot of schools of thoughts on that. And I don't really want to get into that piece, other than to say it is a virus. As you know, influenza is a virus, but this is different. There have been coronaviruses. There are other coronaviruses, but remember, this is the novel or new coronavirus, and the devastation that it's leaving, in its wake and in its trail is much more significant than any of us ever imagined. The coronavirus, and I want to make this distinction when we talk about COVID-19 and we talk about coronavirus. COVID-19 is the disease that you get from contracting the coronavirus. So you hear a lot of people say COVID-19.
Yes.
COVID-19 is the disease.
Okay.
The virus that causes COVID-19 is coronavirus.
Thank you, because I didn't realize that. Well, what are some of the symptoms? I mean, we know with viruses, normally most people have a fever or coughing or something, but this one seems to be a little bit different from that.
It is, and it has been very interesting because the constellation of symptoms associated with it, they are changing. We started with fever, and then we added cough, and then we added chest tightness, and then we added difficulty breathing, and then we added kidney failure, and then we added loss of taste. We even added rash. You've heard of corona toe or COVID toe or COVID hand. So it is manifesting itself in many, many, many different ways. And, it is novel. And so we don't have 100% certainty of all the symptoms, but the ones that we really do know about are fever, chills, cough, congestion, shortness of breath, the rash, loss of smell, loss of taste. Those are the ones that people would probably recognize more than anything. So those are the ones that we typically address on public service announcements and things like that.
I see.
Now, when you said that, the symptoms, as a nurse, it said to me when I started seeing the different manifestations and reading about it and hearing about it, it said to me, okay, it's attacking different systems or all the systems of the body, correct?
Correct. And here's the thing, what we do know now is, and I know that we'll probably talk about this a little bit later on, but as we're talking about symptoms, if an individual develops these, I think that they really should reach out to their healthcare provider, because what we do know is if you receive some type of symptomatic treatment early, then your chances of surviving is much higher than if you don't. And so I know that we'll probably get to that a little bit later on. But as you said, it does attack multiple systems. And, from a physiological standpoint, we as physicians know that it starts what we call a cytokinase cascade. And there are certain medications that we've tried that has slowed that cascade down. The growth of that cascade is what causes all of the long end organ issues that we hear about. And so if we could stop that early on, then people would probably have a better outcome.
Now, can you share with me which medications you've seen some treatment with that help slow some of the progression?
Well, from a data standpoint, the verdict is still out, but we do know that there is the drug remdesivir that's being used, given to patients if they are admitted into the hospital. We have also started to use steroids like dexamethasone. Sometimes if you see your provider in an outpatient setting and you have symptoms that are concerning, particularly those that are related to breathing, they may start you on prednisone or a prednisone taper. Early on, we gave people azithromycin, which is an antibiotic, and we know that antibiotics do not treat viruses, but there are also superimposed bacterial infections that occur or can occur in the lungs. You've heard of people having what we call double pneumonia. So azithromycin has been helpful in those instances. Other medications that are being tried are famotidine, which is a heartburn medication. Again, there's no conclusive data behind any of these, but different institutions are using these things to try to assist people as best we can.
Dr. Wells, my major question for today, all the statistics are showing that communities of color, the Black community, the Latino community, the Asian community, we're the communities that are being most affected by this virus. What happened? What causes that?
Well, I think we have to be careful about saying we have a predisposition to the virus because of some type of genetic makeup, because of a genetic makeup. We just don't know enough about the virus to say that. But what we do know is that when the virus attacks and it causes COVID-19, which is what is really rampant in our communities and what's killing people in our communities, what we do know is if you have underlying conditions and if they are not well controlled, then the likelihood of you not being able to survive this increases exponentially. And we find that heart disease, diabetes, COPD, obesity is a disease that is considered an underlying condition. All of those things weaken your immune system and therefore increases your risk of bad outcomes when it comes to COVID-19. And so I really do believe that it is the underlying conditions that people of color, particularly Black people, particularly Latinx or Hispanic people, particularly Native American people, those are the individuals who are being hit harder than other races.
Okay, so for me then, coming in as a nurse, it would say to be then, okay, we already have the underlying conditions. We probably have less access to health care, either because we're not going to the doctor because of money or insurance, or we're working all the time in order to make the funds because of the jobs we have. So this also affects us not taking care of ourselves with the underlying conditions.
Absolutely. And I do think, and I have said this the entire time, COVID-19 and coronavirus is horrible. But in everything, there is something positive. And I think for me, the positive is that this has illuminated the socioeconomic disparities, the healthcare disparities, the income disparities, the ability to obtain nutritious food disparities. It has illuminated all of the, even informational disparities. It has illuminated all of these disparities. And, when we look at underlying conditions, what we do know is it's because of healthcare disparities. A great amount of it is because of healthcare, economics, income, the ability to provide for families, all of those social determinants of health. When you talk about disparities, you are eventually somewhere down that road, you have to go to healthcare related to people because disparities worsen the healthcare outcomes for people of color, really for anybody. And so we have to talk about that. And I'm really, really glad that you mentioned that, Tamara, because, this has illuminated the fact that there are disparities that have been consistent in Black and brown communities since the beginning of the United States of America, from food, from the ability to get appropriate amounts of rest, from traumatic stress that has been a part of our community for quite some time. And we all know that trauma and stress that is consistent wears on the physical being. And I think all of these things have to be addressed when we're talking about getting people to where they're supposed to be. And one of the things that I say is when we all are well, we all are well. What do I mean by that? When this country recognizes that health for everybody makes everybody healthier, then I think we can see these outcomes. We can see better outcomes, better health for people. When you look at the life expectancies for people of color, just associated with health, not about all of the other things that are going on now, but just associated with health is much less than for other races, and particularly in men, but in women as well. So, I think that we need to address these issues. But for me, as bad as COVID-19 and coronavirus has been, with 180,000, 183,000 deaths now, almost 6 million cases in the United States, and we're only 4% of the population, but we carry 25% the burden of coronavirus and COVID. What that says to me is we've got a lot of work to do when it comes to the disparities across the board in our country.
I'm so glad you said that, because my next thing is, now let's begin thinking about what can we do about this? What can we do about all those disparities that you just mentioned? We've got to start looking at those things, very much so.
Absolutely. And if I'm talking too much, let me know, because I will go on.
These are the things we wanted to talk about.
Yes.
Right. Well, I don't think that there's one fix. I think there are several things that must be done. One, we've got to deal with the disease itself, separate. When I say separate, I mean it is a category of fixing the problem in itself. We've got to decrease the spread. We have to decrease the effects of it, and we need to work on how that's done. We don't need to do it in isolation, just certain communities, but it needs to be across the board. That is one thing, and we can talk a little bit about that a little bit later on, about the discovery of medications, the vaccine, and all of those things, and the things that we're currently doing now, like wearing masks and those behaviors that we've been told to do. Right now, that's the best we have. Yes. And so we have to do that. Other things, and we can talk about them, and I'm not writing them down, I might forget them. So if you bring them back up, that might be helpful. But another thing is addressing these disparities and addressing them separately and collectively. Healthcare, addressing that. Socioeconomic issues, addressing those. Food deserts in our communities, addressing those. Informational deserts, informational disparities, addressing those. Teaching people then how to apply the knowledge they've learned. We always say knowledge is power. Truth of the matter is, applied knowledge is power.
That's right. That's
exactly
right.
If you don't apply it to your life. So I can tell you all day to wear a mask. We've told people for 6 months to wear a mask. And knowledge, you know it, but unless you apply it, it doesn't benefit you. So there are multiple ways that we need to work towards stamping out this illness and others. And then another thing that we really need to address as a people is we need to continue to do what our grandmothers and our grandfathers instilled in us years ago. They gave their last $25 to make sure that their granddaughter got to Fayetteville State Normal School.
Yes, they did.
Education.
Yes,
they did that. They pooled together as a community. And what does that education mean? Now back then it was we developed Black teachers, Black nurses, or what have you. Now we need to pool our resources and develop more Black scientists who are researching these vaccines, who are researching these medications, more Black computer scientists who understand the development of all the technology. We need to be present at the table in the race, moving forward. So I think it's a smorgasbord of things that we should do or should be doing for our people. But for coronavirus, we need to be looking at assisting with development of medications. And I know, we have the vaccines that are coming out and they are doing the trials on the vaccines. And people of color, we are kind of...
I was going to mention that. Yes.
We struggle with trials because historically they have not always been safe for us there's not a good track record in some of the historical trials. And you're talking the 60s, the 50s, you're not talking 200 years ago, and they're talking less than 100 years ago, right, where these trials were performed on individuals without their knowledge, whether it was the Tuskegee syphilis trial, whether it was, where the women in the asylums were, their ability to have children was taken from them. I mean, those things are traumatic things, and they're hard to get over. So to come out with a vaccine that has been made, or we're pushing to make, in less time than we normally make a vaccine. And don't get me wrong, I understand the dire need to have one, but we really need to be careful with the science and follow the science and follow the data. And so I'll stop there because I'll keep going, but today.
Fine, because I've always learned, if you're not at the table, we're on the menu. And so our people do need to be at the table of these things. There's no question.
No, I'm glad you mentioned the education, because I'm thinking that we need to get back to the old days, as you kind of mentioned, yes, where we heard our grandparents talking and pooling their resources together so that we're more educated, so that they taught us what we needed to know so that we could progress and help the whole race progress together.
Look at what they did. Look at what our grandparents and great-grandparents did. I'm a doctor today because that generation of people said, you know what, we need some doctors.
Yes.
Your mom taught school, and you guys are entrepreneurs today because that generation said, okay, we need teachers and we need entrepreneurs.
Yes.
So what we now need has evolved. Yes. We have people putting rockets in space, private people, not the government. We have private people. We need to be able to do those things as well. And I'm not suggesting outdo anybody, but I'm suggesting be there.
Be there.
Be there.
Be there. At the table. That's what you're saying.
At the table. And so I think we need to start thinking about, okay, this technology is coming out. We need to make sure that our children are learning to code. We need to make sure that our children can become computer engineers. We need to make sure that they can become physicists. We need to make sure that they can become architects. We need to ensure that they can become healthcare scientists, because we need to be there. Yes, and I think that's important. And our foreparents and our parents, they did that for us.
They did a wonderful
job. They did it for us.
Yes, they did. I even thought when I was in college, from the church, every quarter, my grandmother's nephew somehow would scrap up $50 every 3 months and bring to me for my college education. $50. But just that in itself was encouragement to help a young Black woman finish college. Just that.
Absolutely. You know what? We really need to get back to that. And we need to understand that $50, even today, if you give a child $50 who's at Fayetteville State or Methodist or wherever they are, if you give them $50, that might mean the difference between being able to eat over the weekend or, just the encouragement of being able to go off campus and buy a hot dog. Those things that we take for granted, that we can, we can affect people's lives in such a profound way. And one of the things that I've started doing, and I'm serious about this, I want to be a philanthropist. And I know that we typically think about philanthropy in the sense of money. And I know that that's the actual definition. But I want to be a philanthropist with what I know. I want to impart everything that I've learned, every experience that I've had. And Sera, you have been a philanthropist of what you know for such a long time. You are one of the reasons we're even having this conversation.
Thank you very much.
And so I want to be a philanthropist. And so one of the things that I've done, growing up, my mom always had this little bill book and you wrote your bills down and you checked them off as you paid them. I haven't computerized that yet. I still write them down. And my goal is for the bills to shrink. And I have a line, I added this line about a year ago that had philanthropy. And under it, I started listing giving. And I want that page to be more full of the philanthropy aspect and less full of the bill aspect. And here's why. If it's more of philanthropy, then I'm focusing less on myself, which means I'm not spending every dime, every dollar on myself, but I'm focusing on the people around me who will one day make a difference. And so that for me is where I'm trying to go in my life. And I know we're not talking about that, but
yes. No, I'm glad you mentioned that because she and I have conversations all the time and she'll ask, what's wrong with you guys in your 40s and 50s or whatever? And I've always said, we've been spoiled.
Yes.
We're more selfish because, we can go and buy what we want for ourselves and do for ourselves. And we don't focus on what you all did, making sure, even if you didn't have the money, that we gave back the knowledge and information that we have to help bring along others. So I'm glad you brought that up. I fuss about it all the time that we do need to be doing more of that.
And more for others, not for me and mine. And I'm going to tell you, my mom, she's deceased, but she is still, and I use the word is, she is still such a powerful force in my life. And there are women who have been that for me. And I'm going to tell you, I remember driving to Pan Drive and coming into the house and going, wow. Oh my gosh. And that was just an experience for me that I had not experienced. I hadn't seen that. And so it was just an encouragement. And then your mom, okay, now Roxie, what you gonna do with this?
Exactly.
What you gonna do with that? And why are you doing that? And don't you think you should consider doing this? And those conversations, and it didn't have to be every day.
Right.
Those conversations, even if they were few and far between, I still remember that. And that still is a driving force for me. I still hear, okay, Roxie, now you got this. What are you going to do with it? And so, I think that it's important.
No, it is. And I hear, what else you going to do next? Are you finished? I'm always, that's my whole life. But I appreciate it because with that, like the show is called Convinced and Confident, that's one reason I wanted it called that. Because of the push that was given to me, I know I'm convinced and confident about whatever I do or whatever I put forth in my life. If I fail at something, I know I will learn from the experience and be able to apply it further. So I'm great because of the push.
Absolutely.
But that did not start with me. I was able to give you what was given to me from the generation before me. My grandmother was like that. There were other women in my life from the church who were like that. And I agree with you. That's one of the things that has been exposed by this virus. We need to be working together in order to heal ourselves. That's actually what you're saying. We've got to heal ourselves, and then we can heal others as well. And there's a generation behind us that needs all of the things we're talking about today.
Absolutely. I don't, and that's why I say that for me, as much as I dislike being sheltering in, as much as I dislike not being able to do the things that we have typically done in the past, this virus, as horrible as it is, has given me the opportunity to do a lot of things better. I mean, when you look at your family and the time that you spend with your family, and I recognize that there are some people who don't enjoy the type of relationship with family that I have. Right. But when you have that opportunity to become closer and to learn and listen to each other and actually hear what the other person thinks and what they're concerned about and what stresses them, what makes them better. Those are good things.
Those are good
out of this virus. When we think about where the country is now, as horrible as it looks right now, and the police brutality and the marching, when you think about that, the protest, it's uncomfortable, but we need to be uncomfortable.
Yes.
We need to be uncomfortable
Must be.
because we can't get better
That's
as
right.
a nation, and we can't get better as a people if we're not uncomfortable.
That's
And
exactly
so, as bad as these things may look, we have the opportunity to pull the good from them and make things better, which is what our foreparents did. God knows, can you imagine what they lived through?
I can't.
No
Can you
comparison.
imagine dogs being pulled on you? Can you imagine all of the things but they looked at it as an opportunity to make things better. We need to do that same thing. And I think that this virus for our community has been a catalyst to help us see that we can pull together, because that's what we're doing right now. We're pulling together as a community to make things better.
Exactly, Roxie.
Now, with that said, Dr. Wells, what makes you convinced and confident?
I think for me, it's an evolving thing. I think, as I stated, my mother is with me every day, although she is not physically here. I think that other women who are physically here and seeing them and seeing their lives and knowing their stories, hearing their stories makes me convinced and confident. There is nothing like a woman sharing her story, her true story, the vulnerabilities of that, the strength, the times that she's cried, the times that she didn't know how ends were going to meet, the time that he left, the time that he died, the time that she was sick, and to watch her pull through that and be a testament to, I'm not alone. I'm not going through this alone. And so for me, it is an evolving thing. Next year, what makes me confident and convinced will be different from this year because I will have lived another year of life. I will have met other people. I will have grown in my own career. I will have grown in helping other people. That's the other thing too. When you see other people and you help them and you see them grow, that is confidence, and that should convince you as well. So for me, I don't know that that will ever stop. I don't know that the evolution of that will ever stop. It's a constellation of things.
Well, ma'am, you are definitely convinced and confident, and I've enjoyed our conversation, and you will definitely have to come back and talk with us again.
I'd love to.
Thank you so much.
Thank you. I enjoyed it.
That's our show, and we thank you for listening. If you like our show, Convinced and Confident, please leave us a rating and download us on Apple Podcasts and Google Play.